Hello, dear colleagues.
Потом, Георгий, чат доставать этот. Все, Кайда, вот еще.
Hello, dear colleagues. Happy to see all of you here. There was some technical problems. We are still waiting for a few more doctors that will join us just in 2-3 more minutes. But we can, I think, start slowly. I'm happy to meet all of you, even online, even we are not able to meet each other personally right now because borders are closed and we cannot fly. But hopefully, hopefully all this situation with pandemic will finish soon and we will be able to meet each other personally somewhere. I will be happy to welcome you to our beautiful country, to Georgia, as well as I will be happy to come to your beautiful country as well. From other side, I'm happy that I have such opportunity to share with you my experience of working with Aptos threads, and hopefully it will be interesting webinar for you and will be helpful for your practice as well. So hopefully our colleagues will join us soon. I will start slowly with my presentation. In any case, I don't have from the beginning something very important. I just would like to say a few words regarding general about threads, about history of Aptos, and about our company. And later, I hope we will have all doctors with us, and we will start speaking regarding methods and indications and how I use Aptos threads in my practice. So I will share my screen, and today I would like to speak mostly about blunt cannulas, blunt methods that we have in our range, because I like to use that product in my practice. It is more safe, it is more easy to use, and of course it is better for the patient because with a blunt tip cannula or round tip cannula without sharp end, I mean, we are able to reduce trauma on tissues of our patient. We are able to reduce time of rehabilitation, of course, and of course it will give us better result. I will start with some slides regarding numbers, regarding statistics, and I would like to refer to ISAP's statistic on this slide that shows that every year during past, for example, 10 years, we see that we increase in our practice injectable procedures. We do more and more injections and less plastic surgery operation. I'm a plastic surgeon and I see the same dynamic in our clinic as well. And we are still, of course, doing a lot of facelifting, so-called facelifts. But every year we increase non-surgical injectable procedures in our practice. Looking on ISAP statistic, I'm a member of ISAPs as well, we can find that, for example, in 2017, almost 500,000 surgical facelift for face rejuvenation was done. In the same year, more than 5 million toxin injections was done, and more than 3 million hyaluronic acid injection also done in the same year. And look on number 6, which is non-surgical skin tightening. This is mostly thread lifting, almost same number like surgical approach, I mean facelifting, almost 500,000 procedure of non-surgical thread lifting mostly was done in 2017. But if we will compare growth between surgical and non-surgical skin tightening, we will see that surgical facelift growth in between 2015-2016 is only 4%. And we have more than 50% growth in case of thread lifting procedure. That again shows that we are doing more and more less invasive procedures in our practice. Our patient asking us to do that kind of procedures more because they don't want to undergo surgical approaches so much. They don't want to have general anesthesia sometimes. And of course, they don't want to have a long-lasting recovery period as well. If we will look to the history, we will see that idea of thread lifting is not so new, and a lot of articles, for example, this one since 1956, shows us that different colleagues try to use different surgical suture material sometimes in combination with the facelift surgery, sometimes as independent procedure, to fix tissues and to elevate tissue and reposition them in the new position. They tried to make this procedure easier for the patient, with the less traumatization. They tried to create different kind of tools like needles or some medical devices as well. And of course, in that time, they was using non-absorbable suture material. My father, Marlen Sulamanidze, plastic surgeon, he is the first who started, who added thread lifting method in aesthetic world. Because before him, there was different articles, some different articles as I showed you, but he's the first who created a special threads for aesthetic face rejuvenation in that time with the thread lifting, and also created a special methods, and he's the first who started a first manufacture of threads. His research about thread lifting started since 1987, as you can see, and his first patent dated since 1996, barbed thread, bidirectional thread. Today we have 18 international patents all over the world, and it covers different kind, size, diameter, design of the threads, as well as different kind of methods. Our first thread, how we call it, first generation thread, was made from proline suture, and it was bidirectional barbed suture with the barbs that are coming from one side to the middle and from another side to the middle, as you can see on this slide. We are the company who started first manufacture of threads for aesthetic, and our first manufacture was created in Russia in 1998. This is the old package of the product from that time, you can see. Another manufacturer, in 2001, we started in USA under the brand name Aptos Feather Lift, and in 2003 we got FDA approval. This manufacturer we created together with company KMI, which is Colster Methods ENC, and later this company created threads with coins, and they become our competitor later, and now you know this product as Silhouette. But in 2001, together with KMI, we started we gave them license for manufacture of Aptos in California, in USA. In 2001, we also created another manufacturer in Italy for European market under the brand name Aptos Soft Lifting, as you can see on this package, together with the company on the base of the company Aptos Europe, which is a quite big surgical suture manufacturer in Italy. And our distributor for European market was company Promo Italia. Today, Aptos present in 75 countries with our partners and distributors. We have 13 international offices in different countries, as well as in Europe, in Asia. We have several offices in Russia. Our main office presents here in Georgia, in Tbilisi, and I'm not only plastic surgeon, I'm also general director of main office of Aptos here in Tbilisi. We have our main manufacturer in Germany, in Berlin, and this manufacturer covers practically whole world for manufacturing of Aptos threads, but we have another manufacturer in Russia, in Moscow, which covers only CIS countries. So the products that are manufactured in Russia, in Moscow, we sell only for CIS countries, and the rest product manufactured in Germany, we export in practically 70 countries. We are also building another new manufacturer here in Tbilisi, in Georgia. 1 year ago, we started with this project, and this is the photos from a year ago. We just started to build it, and we already finished building, and till the end of this year, we should start with the new manufacturer of Aptos thread here in Georgia. I hope, even we have a lot of troubles, logistic troubles because of pandemic, and we are waiting a lot of engineering systems from Europe here to Georgia to build this manufacturer. I hope we will finish this building till the end of this year, and next year I will be happy to invite you to our manufacturer here in Tbilisi as well, and you will be able to see our beautiful country, beautiful Tbilisi, as well as our new manufacturer here. So today I will speak, I will repeat again, regarding blunt, round tip cannulas and methods that I use in my practice. And I will share you my experience, which methods in which case I like to use, and how I like to do it, how I choose patients and methods as well. Of course, I will divide face of the patient anatomically, and let's speak regarding eyebrow area, regarding forehead area. For elevation of eyebrow, end of the eyebrow, or two-thirds of eyebrow, my favorite method and my favorite product, of course, is needle blunt method. This is the two cannulas with the blunt ends from each side of the cannula. Thread is connected from one side of the cannula and connected to another cannula as well, as you can see here. It is 50 centimeters long, and bulbs are coming bidirectional. Bulbs are coming from one side to another side to the middle. With that method, with that needles, we are able to create some kind triangles on eyebrow, on forehead, to fix thread here and to elevate eyebrow, and I will show you how we do it with small video later. Looking on anatomy of this place, or of this area, we know that usually patient has here very thin skin. Practically no soft tissue layer in between skin and frontalis muscle fascia. A lot of superficial vessels. That's why it is very important to use very smooth cannulas and blunt tip cannulas to avoid traumatization of the vessels. Also, it is very important to do a proper local anesthesia, because we need to elevate skin from the muscle a little bit. It is some kind of hydrodissection, but not exactly hydrodissection, of course, because we do not dissect. We do not need to dissect tissues. We just need to elevate skin and create a layer between frontalis muscle fascia and skin, where thread and cannula will slide when we will implant threads. For the entry point, usually I am choosing 0.3 centimeter above the angle of the eyebrow, depending which direction I need to elevate eyebrow. If I need to elevate eyebrow more vertically, I choose entry point on a more vertical position here, near to the hairline, usually about 3 centimeters above. If I need to elevate eyebrow more laterally, I choose entry point, of course, more laterally. Then I do a local anesthesia, of course, just a little bit separate skin from the muscle, and with the needles I'm drop down under the skin, and there is my fixation. While fascia of frontalis muscle is quite superficially near to the skin, the fibrotic tissues from the fascia is going up to the skin, and we have enough points for fixation of our thread. So we do not need to go deep to the muscle or to the periosteum, for example, to fix our thread. We just need to drop down under the skin, and it will be enough for us for the fixation of the thread. Then we are placing thread with the cannula in between skin and muscle and moving down to the eyebrow. In that case, of course, we are passing upper periorbital and upper medial compartment, and we are catching a lateral part of upper periorbital compartment to elevate it vertically or laterally, depending which direction we need to do it. This is my case. You can see this patient, 2 cannulas with a blunt tip, not sharp, 1 entry point. I separate needles, and then I pass with the first needle under the skin and crossing a little bit border of eyebrow. You can see I'm going down a little bit because I need to catch upper eyelid as well, a little bit the border of eyelid, of course. And with the first needle, I'm creating some kind of loop here, triangle, going back. With the second one, again, it is very important to turn your cannula inside of tissues, not exit and enter again, otherwise you can have a depression. With the tip of the cannula, I'm just turning my cannula inside of tissue without removing it out. Second one, same way. Even this is the blunt tip cannula. It gives me possibility to exit skin. It is designed so that it has an angle at the end, so I can exit and enter to the skin, of course. And you can see that I'm doing a lot of movements inside. I'm creating 2 loops, like 2 triangles inside, and even in that case, I'm not damaging tissues too much because I have very smooth cannulas, blunt tip at the end, you can see, so it is not so traumatic and practically no drop of the blood is there. So I'm sure that I will not have any hematomas. So 2 triangles already created on both sides, and now I'm just elevating ends of the threads and fixing threads in that position. This patient already did blepharoplasty before me, upper blepharoplasty, and of course I have seen extra skin on her upper eyelid, and I told her that it will be better if we will repeat blepharoplasty for her, but she decided and asked me to do threads only to elevate angle of the eyebrows together with the upper eyelid as well. Another method which I use in my practice as well is nano-excellence. In case of Aptos, we have a lot of different kind of methods. We have 30 different kind of product in our range, but it doesn't mean that you have to use all of them for all of your patients. Of course not. It is impossible to understand all these methods from the beginning and to know all these methods from the beginning, but each method is created for the special situation, for the special patients and special indications as well. In case of Aptos, we are trying to create solution for the doctor and for the patient. That means that first we are understanding the problem and indication. Then we create method to solve this problem, and of course together with the method we are creating a special product for it. So each product, each design of the thread and cannula is specially dedicated to the different kind indication and different kind patients as well. So in case of nano excellence method, which is 10 cannulas with a blunt tip or a new version which we just present a few months ago, Nano Excellence with hyaluronic acid thread, and later I will speak regarding hyaluronic acid thread. This is the unique composition of the thread. This threads has also round tip cannulas, a classical cannulas, and thread is preloaded inside multi-barb thread, which means that each barb look to each other, not a bidirectional barb, just each barb is looking to each other. That means that we are increasing fixation of the thread inside much more than in case of bidirectional thread. So this is the package, how it looks like. We have 5 and 5 cannulas, 7 centimeter long, 21 gauge cannula, very, very thin in the diameter cannula, together with the 18 gauge needle for entry point preparation, and also 23 gauge infiltration cannula. You can see the blue handpiece cannula. This is for infiltration of local anesthesia, because we need to give you possibility to do a local anesthesia as well with the cannula and not with the needle, to prevent tissue traumatization, of course. This is another patient with which asking me to elevate end of the eyebrow. New cannula with a round tip, with a thread with multi-barbs, with hyaluronic acid composition. I will speak about it later. So I will create triangles inside under the skin. Same layer between skin and muscle. Same entry point, depending which direction you need, laterally 3 centimeters. And I'm going right under the skin, sliding under the dermis with the cannula. Going forward, back, and one more time forward. So I'm creating some kind of V inside with the point of fixation. That means that this is not a free-floating thread. This is the thread with the point of fixation on entry point. It gives me extra fixation inside, and of course it will give me much more stronger result, and the result will stay better in case of if we will compare it just with any other methods like a free-floating threads. So as I told you, we have 5 and 5 cannulas, 10 in the pack, and of course I separate them for 5 and 5 for each side. Each thread is crossing the previous one. So first V, second V, third V, and so on. So I'm creating some kind double V inside several times. You already can see nice elevation of eyebrow. Very nice result. Immediately after, just few minutes to work, one entry point, practically no trauma, because we have a round tip cannula. It will slide between vessels and it will not damage vessels so easy as any needle. So how I choose, in which case I'm using needle methods with the 2 needles blunt tips, which I choose, which I showed you with the previous video, and when I choose Nano Excellence. In case when I have young patient like her, in case when my patient asking me just for small correction of end of the eyebrow or upper eyelid as well. In case I don't have heavy tissues or thick skin, in case I don't have a male case, or in case you are beginner in the threads, Nano Excellence will be the best solution for you, because it is very easy in use. It is just not traumatic, as you can see, round tip cannulas, and practically no swelling. In case I have a heavy tissues, in case I have aging patient, male case, or my patient asking me to elevate tissues too high, I will choose first method, needle method. In that case, I can catch and lift and elevate tissues how strong I need, because I'm creating a loops inside with the point of fixation, and I'm able to elevate tissues quite strongly. This is the patient immediately after, no, not immediately, just few days after of using Nano Excellence with the hyaluronic acid threads for eyebrow elevation, practically no swelling, a little bit bursting. maybe, and of course, usually it takes just a few days for rehabilitation. Also, a few days later, 1 year and a half, 1.5 years after, result with the needle method. Here you can see patient, of course, we usually combine threads with the toxin for forehead. It is very important because we should understand that mimic activity is the main enemy of the thread fixation. We are losing fixation of the thread if mimic on the forehead will strongly work inside, and it will destroy our fixation in the nearest 1 year. But this is 1 year and after, 1.5 years after, but this patient repeating toxin injection. She did it before threads, and every 6 months she is repeating toxin injection. Almost 1 year after as well, about 8 months later, result. As you can see, we are elevating not only end of the eyebrow, but also we are able to elevate the upper eyelid as well, the lateral part of upper eyelid, as well as angle of the eye a little bit changed in her case. So this is the how the threads are working here, and I'm sure that I'm doing this procedure very easy. No rehabilitation time practically, and very nice and long-lasting result. Let's speak regarding cheekbone area. Of course, in that case, my favorite method and the best solution for the face is Excellence Visage Thread. We have a special product dedicated for the face rejuvenation, and the name shows us that this is the best for the face. Excellence Visage, and we have a new generation of Excellence Visage, third generation, which is Excellence Visage with hyaluronic acid, HA. This is very important that this is the unique product. There is no other products similar to this thread present on the market. Only Aptos has the thread which is composition includes hyaluronic acid inside. The new formula we have on the threads is polylactic and polycaprolactone acid together with hyaluronic acid. So what we are getting and what benefits we are having with such kind composition. Of course, this is a more biocompatibility of implant for the tissue. It is reducing inflammatory reaction, and it gives us a real collagen and elastin stimulation in case of that kind of thread. When we are speaking regarding biostimulation from the thread lifting, if we will look on the threads that are present on the market made from usual surgical suture material like PDO, PDS, or polyglycolic, or just PLA, for example, PCL material. This is just a surgical suture material. How it can give us a real stimulation effect. In reality, when we are adding some kind of implant inside of tissue, this implant increasing stimulation of collagen stimulation around it. It is increasing vessel creations as well as quantity of the vessels or diameter of the vessels. That means that we are increasing microcirculatory effect around the thread. And of course, it gives us some stimulation effect around it. But when we are looking for stimulation effect, for example, when we are doing hyaluronic acid mesotherapy, we are looking and expecting this stimulation effect from foreign body, foreign implant which we are implanting as a hyaluronic acid, or just damaging tissues with the needle? Of course not. When we are expecting stimulation, we are expecting the stimulation from composition of hyaluronic acid when we do injections. That means that when we are getting some stimulation effect from surgical suture material like PDO, PLA, or polyglycolic acid, this is just a damaging of tissue from the foreign body and nothing else. We need a real stimulation that will work as stimulator. That's why Aptos decided to add hyaluronic acid itself, the best stimulator we have on the market right now, inside of composition of the thread. This is very important. We work it a lot. We started with this idea and this research since 2015, and we have a lot of research done since that time, and publications as well. One of this research I would like to present right now here, histology research, one of the first one, that shows that which benefits we can get from the thread with hyaluronic acid. So we compared PLACL Aptos thread, a usual PLACL, and another PLACL with hyaluronic acid histologically done on the pigs. First of all, what we have seen is that we can see on this diagram that shows the orange line, which is practically straight line, that shows that inflammatory reaction around the thread is quite stable. It means the thread with the hyaluronic acid reducing inflammatory reaction around the thread. It is very important, and for the patient and for the doctor as well, that means that we are reducing time of rehabilitation of our patient with the thread with hyaluronic acid. With the second side, another side, we are also reducing connective tissue formation around that kind of thread. Look on the photos with the thread without hyaluronic acid and with the thread with hyaluronic acid and capsule around it. And that means that with the reducing of connective tissue capsule around that kind of threads, we are able also to reduce connective tissue formation. And while our patient repeating the procedure periodically every 1.5 or 2 years, we can be sure that we are not adding new fibrotic tissues inside of tissue of our patient, and we are reducing capsule formation around the thread. From other side, we can say that this slide, this diagram shows that elastin stimulation starting from 2nd week after implantation, in comparing with the classical PLACL threads. So hyaluronic acid threads really stimulate tissue because of composition of the thread, and not just because of traumatization and foreign body implantation. And collagen first and third type also increase in stimulation for almost 25%, as you can see here, immediately after 2 weeks after implantation. So with the new generation Aptos threads, with the new composition of threads with hyaluronic acid, we are reducing inflammatory reaction. That means that we accelerate rehabilitation process. We are reducing connective tissue formation. That means that we are not adding new scars inside of tissue. And of course, we are creating a real stimulation effect around that thread. So we are increasing stimulation of elastin, and of course we are increasing stimulation of collagen first and third type, which is really important for tissue of our patient. So how looks this thread? This is the multi-barb again of the thread, PLACL with hyaluronic acid. Each thread is preloaded in the cannula. For the fixation point, usually what I'm doing is that for cheekbone area, I'm choosing entry point on the straight line from the angle of the eye till the hairline, and right before the hairline, I mark entry point. From this entry point, I usually mark upper border, which is, I should not pass upper. This is the border in between cheekbone area and lower eyelid, so I should not insert my thread on lower eyelid. Of course, it should be lower. And lower border is usually till the jaw compartment here. So in between this triangle, I enter several threads. And which is very important, I can create volume here as well. If I will go deep I will slide right above muscles. As you can see here, let me show you this animation one more time. If I will slide with my cannula deep above SMAS, I will harvest tissue from the deep and I will create volume right above thread. So all tissues which I'm catching with my fingers right now, this is just a soft tissue practically. So I'm able to pass it down under the tissues right above muscle. And while I'm using cannula, round tip cannula, I'm sure that my cannula will not catch muscle, will not go too deep. It will slide above SMAS, and I will be able to create and elevate tissue and create volume. And depending, if I don't need to create volume and I just need to get a lifting effect, I will go more superficially near to the skin, not harvesting tissue deep and just creating lifting effect. So this is the cadaver tissue, and it shows how deep usually we go with the cannula to harvest tissue right above SMAS. So we are not catching SMAS. We are not damaging tissues, and we are and we are not damaging muscles as well, of course. So we are safe because we are working above SMAS and above any big vessels or nerves we have in the layer of SMAS. So we are working safe while we are working above SMAS, and we are sure that we are not entering to the SMAS because we are using round tip cannulas. So what I'm trying to do in that case, I'm catching nasolabial compartment, which is present here, and dropping down from lateral to the medial line and creating nasolabial compartment. Also, I'm catching medial buccal compartment or central buccal compartment, which is just dropping down vertically that direction. So I'm catching these both compartments. I'm trying to connect them together, create volume with them, and lift this volume above cheekbone to create a volume on the cheekbone area. In that case, of course, threads are not fillers, and with the threads we are not adding volume like with the fillers. We are just repositing own volume of the patient on the new position, which is also very, very important because we are not making face more heavy like with the fillers, because it is not adding volume, just own volume, which is repositing on the new position. This is a small video how I'm doing this procedure, of course under the local anesthesia and following all aseptic rules. 2 entry points, because I have 10 cannulas, 15 centimeter long, with the thread preloaded inside. This is the package, you can see. So I don't need all these threads for cheekbone area only. I will separate some of the threads I will use for the jawline, and the rest I will use for the cheekbone area. Round tip cannula, 15 centimeter long, thread is preloaded inside. As you can see, I'm starting from the tragus for the jawline and entering the thread again like I did for eyebrow, like a V. Yes, I have a point of fixation near to the tragus. So this is not a free-floating thread. It is very important. It has a point of fixation, so fixation is quite strong and quite stable. So you already can see I elevated jawline very nice, and I already created a nice sharp line of jaw, and you can see these wrinkles that I created. And now I need to go deep for cheekbone area to harvest tissues from the deep to create volume, reposit volume. One from the down, one from the up. So I'm locking tissues in between 2 lines of the thread. 1 thread for marionette line as well, not crossing marionette, just stopping before marionette, of course. And you see how nice result I got immediately after. Nice volume formation on cheekbone area. Even marionette line elevated, a nice jaw created on the patient face. And practically no swelling immediately after. Look on her face right after the procedure. I created a sharp triangle with the sharp lines of jaw. I created a nice round cheek bone, cheeks with on the bone, using her own volume. Of course, there is some swelling, and that's why it is too big right now. And of course, there is some overcorrection, which I am usually trying to get. But this nice volume can be created by using own tissues of the patient, not adding nothing on the cheeks. Another patient just 3 days after, you can see entry point here is still present, but practically no swelling, and she looks nice. 8 months after, nice elevation of cheekbone area, nice reduction of nasolabial and marionette line, nice line of jawline of the patient. But 8 months after, look on the skin quality for her face. We did no other injections, just one package of Excellence Visage thread for her, and look on the difference on the skin. This is the real stimulation from the composition of the thread. Another patient, aging patient, as a plastic surgeon, when I see such patient, of course, I understand that the best solution for them is a facelifting surgery. But this patient never did anything for her face, even never did any injections before. And she came first time to my clinic, first time to plastic surgeon, and she doesn't want to have a dramatic changes on her face. She doesn't want to do facelifting. She just wants to have some, let's say, to refresh her face a little bit. This is almost 1 year and 1 month after. You can see a nice elevation of tissues on the face, but look on the skin quality, how it changes after of using threads with hyaluronic acid Excellence Visage. So when I have patients with not heavy tissues, when I just need to elevate tissues up, I don't, it is not too much, not aging patient, but even you have aging patient, but like this, which is not heavy tissue, seeing that skin is very thin. Excellence Visage with hyaluronic acid is best solution, because you are using one package of the thread and you have a solution for different cases, for different patients, different areas as well. You can separate 5 and 5 threads for each side, depending where you need more fixation, cheeks or jaws. I would like to show you another solution, which is combination of 2 different kind of thread we have in our range, which is Nano Excellence, and I showed it you for eyebrow, and Nano Spring. This is the spring. This is the thread. Looks like a real spring, and it is fixed on the blunt tip cannula. It is very good for such patients. Look on her face. Flatty tissues drop it down. She's aging, of course, and tissues is more or less heavy, not very much, but she has quite deep nasolabial fold, and she has no volume on the cheeks. So what I need here is I need to add volume on nasolabial fold, and I need to create volume on the cheekbone area. But she doesn't want to use fillers. She afraid that if we will use fillers on nasolabial fold together with the cheekbone area, it will make her face more round, more heavy. And she just wants to elevate tissues up and to create volume by not by adding volume on the cheeks, but just with repositing volume on her face. So let me show you how we did it. First, I'm using spring thread, nano spring. Thread is fixed on the cannula, so before we enter, we have to unfix it. You see that it is fixed on the cannula. So first, I'm catching cannula and thread with my fingers and turning against clockwise, opposite direction of clockwise cannula itself. You see that thread becoming more and more white. This part is already unfixed. This part is still fixed because it's more black color or more dark color. Now I'm turning more, and now thread is sliding on the cannula. So it is ready for implantation. I'm implanting thread right along nasolabial fold in soft tissue. Of course, local anesthesia already done. I'm leaving thread inside, removing cannula out. Immediately I'm doing small massage because I need to press tissues in between rolls of the spring. This will catch spring and it will not migrate anywhere, of course. The thread looks like a real spring, so if you will remove it from the cannula, it will not be a straight thread. It will be like a real spring. That means that it is working with the mimic activity, and it will always stay in the same place where you implanted it. It is very important as well, because again, I would like to repeat that hyaluronic acid is one of the best possibility for filling of nasolabial fold. But if we have too deep nasolabial fold, if mimic activity on nasolabial fold is very aggressive, we have a risk that hyaluronic acid can migrate somewhere. In case with the nano spring, it will never migrate and it will stay in the same position. I'm placing threads like a sandwich, one above each other, and I'm creating volume with the threads. And of course, while thread is absorption period is almost 2 years, it means that result will be much longer than hyaluronic acid injection. And now I'm using nano excellence as I did visage thread for cheekbone area. But this is just a small thread. Look what I can create with small 7 centimeter thread with the cannula. Just going deep in tissue, soft tissue, above SMAS, making like a locking tissues in between the line of the thread. I'm harvesting and repositing tissues laterally to the bone. Look on this volume which I created. So this is the natural volume of the patient, not adding volume with some kind filler. Just repositing nasolabial compartment, which is near to nasolabial fold, and medial buccal compartment, which is dropped down up to the bone, and creation such kind nice volume, round shape of cheekbone area. I'm repeating same on the opposite side. Nano spring first. Again, I would like to repeat that you should remember that before you implanting spring, you have to open it. So you are catching cannula with the finger and turning against clockwise several times cannula, and you will see how your spring is unfixed from the cannula. And as soon as spring is sliding on the cannula, you are ready to implant it inside tissues. And nano spring. 10 cannulas in the package you have with nano excellence in this case, with a preloaded thread, multi-barbs, threads with hyaluronic acid again, you can choose. And I'm also making like a V, but like a locking inside of tissues. Look immediately after. So we created a nice volume on the cheeks. Also, even we elevated only cheekbone area and nasolabial fold, look on the jawline, it became much better immediately after the procedure. So with just 10 threads, 7 centimeter long cannulas, nano spring, which I implanted to the nasolabial fold, and 10 threads, one package of this and one package of another one, of nano excellence, which I am implanted to the cheekbone area, I am receiving immediately after such results of volumization of middle face. This is about 6 months later. You can see a nice result of elevation of tissue as well as of creation of volume on cheekbone area. Young patient, here I use it only nano excellence for volumization. In that case, she's so young that we cannot speak regarding aging processes or aging problems. No, when we are doing aesthetic procedures, we are doing it for two ways. First is aging against aging processes, and this is, and in case of threads, we are doing threads for tissue elevation. So we are working against ptosis, anti-ptosis. That's why we call our threads Aptos, anti-ptosis. So we are working exactly against ptosis with our threads. And another way is rejuvenation, beautification, sorry. So here we did it for beautification. We created a volume on the cheekbone area. Of course, we are able in that case to use fillers, and no problem, fillers is easy solution as well for the cheekbone area, for example, volumization. But this patient, and we have a lot of such patients who disagree to volumize and to make a face heavier. They want to use their own volume. So I use it only 10 threads, nano excellence, one package, which is already 10 threads in the package for cheekbone area, and I reposited tissue on cheek with that kind of volume. Another case, full face visage thread and nano excellence for eyebrow area as well, almost 1 year after. Nice elevation of eyebrow as well as nice elevation of cheekbone area, marionette line, and jawline as well. Let's speak regarding lower face. For the lower face, of course, the best solution is thread method. If you want to solve the problem only for jaws and you are not going to touch cheeks, of course, you can open only one package of thread method. And in my case, I'm usually using blunt tip cannula. We have the similar with the sharp ends, thread soft, but you can use blunt tip as I like to do it usually. So for fixation, I'm choosing the entry point near to the tragus. What I'm doing is I'm creating with my fingers wrinkles near to the tragus, and right inside of this wrinkle, I'm adding a point for fixation of my thread. First of all, this point is good for the traction because it is high traction and line along the jaw, so you are following the jaw with your thread. Second point for fixation is also good for the thread because here we have parotid gland, which has quite strong capsule around it, and tissues from this capsule, fibrotic tissues, are going up to the skin. So this area is quite strong with wrapper points, and as soon as you just drop under the skin, you will be in the same plane where these tissues are present, fibrotic tissues present, and you will be able to fix your threads nicely. And you need just to follow your jawline and exit near to the jawline to catch jawline and elevate it up. In that case, of course, we are entering our thread quite superficially near to the skin because we don't need to create any volume here. We just need to lift skin and get, let's say, lifting of tissue. Sometimes if my patient has a problem on submental area under the chin, I'm combine thread methods, thread to G methods on the jaw or on the neck together with the nano excellence here. In that case, with the nano excellence, I'm creating some kind of net here, as you can see on this marking. So I'm armoring submental area under the neck, and then I'm repositing tissues up on the jaws or to the neck, like you can see here. Or I can do both. So let me show you this small video. Entry point, how I choose it for nano excellence for armoring submental area is from the medial line 6 cm laterally under the jaw. This is the first point. 6 centimeters under the jaw, second point. From this entry point, I'm inserting 5 and 5 thread. As you remember, we have 10 thread in the package, 10 cannulas, which with the thread preloaded inside. So 5 and 5, which are crossing each other at the middle, and I'm creating some kind of net here first. So when my patient has a problem of the skin here, I'm able to armor tissues first, and then I need to reposit tissues laterally. Sometimes only this procedure is enough for young patients, but for aging patients, of course, tissues are quite heavy and we need to move them laterally. That's why I'm starting with the needle, or with the thread method, behind the earlobe for the fixation for the neck, and exit near to the medial line here. And for the jawline as well, I'm starting from the tragus, as I showed you, crossing jaw compartment and exit here. So I'm moving tissues laterally, not on the jaw, but also on submental area under the chin as well. From the opposite line, or opposite side, I do the same. Blunt tip cannulas, again. Of course, you can choose the same product we have with the sharp ends if you like, depending on your patient. And you can see immediately after, quite nice, sharp jaw together with the sharp lower face, neck as well. And while I'm using threads with the blunt tip cannulas, I'm sure that I'm not damaging tissue so much. Just a few days later. 1 year and few months after. 1 year and 2 months, as I remember here. 1 year and 1 month after. Almost 1 year again. Let's speak regarding submental area. And the best solution for submental area again is the needle methods. When we have heavy tissues, when we have active mimicry area, when we need to get a strong fixation of tissues, needle is the best. Here we can create hammock on the neck, practically like a hammock. We are starting from one earlobe and moving with the 2 threads on the opposite side, and from this side with the second pair of needles, I'm moving to the opposite side like a hammock on the neck. In that case, of course, the fixation could be a mastoideus area, but mastoideus area is too high and too strong for the cannulas and even for the needles, and sometimes it is difficult to start from there. So we don't start from the mastoideus. We suggest to start from and catch platysma auricular ligament, which is present right behind the earlobe. So what I'm doing is I'm catching earlobe of the patient, elevating it like I'm doing right now, and starting right behind it with the 2 needles. Sometimes when I need to get extra fixation of submental area on the medial line, I combine it with the nano excellence. Not always, of course, only in case when I have a heavy neck with the extra skin as well, aging patients, for example. For her, I did it, as you can see, entry point present here. So behind earlobe, I started with 2 needles. You can choose blunt tip as I did right here as well. I like to use blunt tip because even it is a blunt tip cannulas, you still are able to pass skin. You already turn your tip inside of tissue, not exit and enter again. Otherwise, you have a depression which you need to dissect later. And here you have not problems like this. Of course, blunt tip cannula is good for young patient, for patient with thick skin, not heavy tissues, and cannula will slide easily. But in case you have male case, for example, when you have a patient with a thick skin, patient after facelifting or liposuction done before few years ago, I mean with the strong tissues, with the fibrotic tissues, of course it's better to choose not blunt tip but soft thread needle soft method, which is with a sharp end. That means that you will slide inside. Easier, of course, with the sharp ends. But with the blunt tip, you have less risk of damaging tissues. You have a less risk that you will catch skin and you will have a depression. You will have a less risk that you will go deep and you will catch muscle and you will have a hematomas, for example. And the rehabilitation period just a few days after is very, very fast. Usually you can see it just 2 days after. Still entry point present here. More than 1 year after. This is several combination, of course, of different threads. When we have some active platysma bands, of course, we stop platysma bands before with the toxin, and then we do threads, because we have to understand that mimic activity is the main enemy of the thread fixation, and we can lose fixation of the thread in the short period. That's why we need to stop mimic activity. And before I will finish with the methods I'm using in my practice, I would like to say a few words regarding a new product also we just presented this year. Aptos is the company who is the first on the market since 19 market of threads, I mean, aesthetic market of threads. Since 1996, and we are the first who started to manufacture. And since that, every year or every second year, our company presenting new and new methods and new products for different areas, for different indications, for different possibilities, as well as we have product and methods dedicated to the face rejuvenation, product and methods that we are using for the body, and we have a special line, Excellence Body, for example. We have threads for the special areas, like for the ear correction, for nose, I will speak about it. We have threads for intimate plasty as well. And this is the new product, new method, which we just presented months ago, soul rhinoplasty, we call it so. So this is the similar to Excellence thread, which is round tip cannulas, 5 cannulas, 12 centimeter long, again multi-bar thread inside, preloaded in the cannula. So this is the way how we implant the thread. From tip of the nose, you can see the line, how it is implanted, and let me show you a small video. Under local anesthesia, I will pass this local anesthesia. So how we implant the thread? From this entry point, we move cannula and we leave thread that direction, in that direction. So we are starting from the tip, moving in between cartilages, and then deep on periosteum, on the bridge, on the nasion. Elevating tip of the nose, removing cannula back, and not removing totally, just going down. And we are repeating this movement several times. So that way we implant several threads, as you can see. And we are able to elevate tip of the nose, but also we are able to create volume on the nasion, on the bridge of the nose. Like, for example, for her, here I need volume, so here I need volume, So I'm going back, stop before the border where I need volume, and now then I'm implanting several times thread like a sandwich inside. So I'm adding volume with the thread. So in comparing to the face, thread on the nose is not giving us exactly lifting effect, repositing effect of tissues. No, we are adding threads on the nose like armoring tissue, like new tissue for the nose correction. So we are armoring tissues on the nose. And of course, this method is much more safer and easier than filler injection, because in case of threads, you will never get such dramatic complication which you can have with the filler. Thread will never migrate or close vessel on the nose. So you are sure that this method is much safer than injection of filler on the nose. And you can see it is very easy to do. Of course, that method gives us immediate result, even stopping a little bit activity of the nose movement. Of course, it's not working like a toxin, but while we are armoring nose with the thread, it is stopping of activity and elevating tip of the nose up. With such easy method, you are getting immediate results with the short time of recovery, and the result usually stays around 1.5 to 2 years. I will not stop on the conclusion of my presentation. This is the reference to the articles, publications, and research we did in the past few years. I use it for my presentation, these articles. You can, most of them you can find on our website, aptos.global. And at the end of my presentation, I just would like to say that during this past few months, because of pandemic, and this situation happens all over the world, we did a lot of different webinars together with my colleagues. We spoke a lot regarding threads, and we spoke regarding different methods, different indications, as well as different combination of thread with the different injectable procedures or surgical operations. We did several webinars regarding complication of threads, as well as several webinars regarding anatomy. All these webinars you can find on our Facebook group, Aptos Expert, or you can find them on our portal, aptosvideo.com. This is the website where is present more than 500 videos of using Aptos on different cases and different patients. And also, I would like to invite you, colleagues, to the Congress, which will be held just in 1 week, next weekend, 4 and 5 of July. It will be, unfortunately, online this year. We do it every year here in Georgia. It calls Colchida 2020 this year. So this is the Congress about plastic surgery and aesthetic dermatology. During 2 days, we have very interesting speakers from different countries all over the world. We will have very interesting sessions on plastic surgery. We will speak a lot regarding body surgery, face surgery, of course, rhinoplasty. We will have ISAPS symposium as well. And for aesthetic dermatology, we will have several sessions dedicated to toxin injections, dedicated to filler injections. Together with IMCAS Academy, we will speak half day regarding complications. We have IMCAS alert session. And of course, we have a threat session as well as intimate gynecology plasty as well. So welcome to our Congress that will be held next weekend, 4 and 5 of July. So, dear colleagues, I finish it with my presentation. Now we are able to discuss any questions you have. Now I will check if there is any questions on the chat. Let me see. When you do the visage, the second leg of the V always have the same length of the first one, or it is smaller, depending which thread I am using. If this is a excellence visage thread, which is 15 centimeter long, sometimes if I do it, for example, on the cheeks, I do it several times because cheek is small, and I can create like a double V inside with one thread only. If it is on the jaw, maybe it will be the similar one. Or if I do excellence visage soft, sometimes it is smaller like this. But the question is that I always have this entry point fixation. So it is always like V or semi-V, but fixation always present. Do you have a lot of bursing of the nose? No. As you have seen, patient immediately after looks very nice because we are using cannula, round tip cannula first. Second, we are working here in between cartilages, but on the bone, we are working right sliding on the bone. So we are under the vessels and trying to not damage the vessels. And cannulas are really very smooth, and you are avoiding to damage vessels, and you don't have bursing of the nose usually. Thank you. Thank you. I'm happy that it was interesting for you. Dear colleagues, if you have more questions, please write here, or you can turn your mic and any protocol regarding thread removal if there is complication. First of all, again, I would like to repeat that on the aptosvideo.com or on Aptos Expert on Facebook group, you can find a full webinar regarding complication. And there I speak a lot regarding how to remove and when to remove threads, exactly with the technique. But in few words, I will tell you that if we will generally speak regarding complication with the threads, most complications that we have with the threads can be solved quite easily. Just with the massage of the fingers, just pressing tissues, or dissection of tissue if skin is depressed. And in most cases, this is the problem of rehabilitation, swelling, or small hematomas, or the problem of wrong way of insertion, for example, too superficially or too deep insertion of the thread. But and it is easy to solve this problem first 2 weeks maximum. But if you already have a complication which is more long than 2 or 3 weeks after, or you need to remove threads which is very superficially inserted, for example, in that case you don't need to cut skin with a knife. No, it is usually just enough to do a local anesthesia a little bit, to use hook. You can make this hook with the 18-gauge needle, or you can just buy a sewing hooks, a usual sewing hooks, sterilize it, and it will be easy to use to catch your thread inside, and you are just catching thread and removing out. So it will take you a few minutes usually to remove thread out. In my webinars, which already we did just a few weeks ago, you can find on Aptos Expert and aptosvideo.com. I speak a lot regarding this problem, how to remove thread, and what is the technique, step by step. I explain so you can see there. Dear colleagues, maybe few more questions if you have. Before, maybe you write, is there any protocol? Thank you very much. Okay, great. I would like to say also that we are the company which is, let's say, on the top of the company, we have a doctors. This is my father, Marlene Sulamanidze, plastic surgeon, me as a general director, George Sulamanidze, plastic surgeon as well, and my brother, Konstantin Sulamanidze, he is also plastic surgeon. And we are inventors of Aptos. So all the methods, all the threads that we are creating are coming from doctors to you, my colleagues. So we always are ready to share with you with our experience. We are always ready to give you more information regarding thread lifting, regarding Aptos itself, to give you more information about how to use it, how to choose patient, and how to do the procedure correctly, and of course receive a good long-lasting result. So if you will have any questions, if you will have anything you would like to know more, please ask my colleagues, our partners in Portugal, or my colleagues here in Georgia. We will organize for you a special webinars dedicated to your questions directly. For example, you have some special patients, or you would like to know more indication in some areas on the face or body, or you would like to solve some problems or difficult case, for example, we will be happy to organize for you a special webinar with one of us or one of our trainers and share with you our experience. I have one more question. If you will compare Silhouette with Aptos, which product you use? Of course, I use Aptos, and I already told you regarding history of Silhouette. Together with the company KMI, we started in 2001 with the Aptos. We created together manufacture in USA, in California. It was a small city, not so small, but for California, I think small, Anaheim. And we created first generation thread manufacturer in 2001 together with KMI. In 2004 or 5, they created Silhouette, threads with coins, and they decided to go alone, and they became our competitor. Since that, Silhouette was sold several times to different countries. Last year, it was sold also to one of the Chinese company as well. So what is the difference? Let's say, first of all, composition. Composition of Silhouette is, the thread is PLA, polylactic only. That means that PLA thread, if you will see the different research, and you can find it in open publications, absorbs in less than 1 year. So the thread itself stays in tissue only 1 year and absorbs totally at the end of 1 year. From other side, coins which are present on the thread are made from combination of PLA and polyglycolic acid. And you also can find one of research made by doctors, KOL doctors of Silhouette, that shows in 2016, as I remember, that shows that coin itself, fixators that should fix threads inside of tissue, absorbs in 6 months. That means that after 6 months, there is no more fixation of the thread inside, and after 1 year, there is no more thread inside of tissue. But this is the total absorption. That means that fixation of the thread will losing earlier than 6 months. So that's why result of Silhouette thread cannot be so long. This is the first. Second, even coins are stronger and bigger than than barbs, than the hooks we have on the threads. We have just several coins on the thread. It is, as I remember, 4, 6, 8 or something like this. So we are not distributing tissues all along the thread. Between each coin we have quite long portion of the thread which is not holding anything, and that means that we are not distributing tissues all along the thread so good. And the last thing is that in case of silhouette we have only one solution, and unfortunately in medicine we cannot have one solution for all the patients. We have different patients, different age, different areas on the face, different indications as well. So we cannot use only one product, one method, just a difference of the length. For eyebrow, for cheeks, for jaws, for neck, for body, for aging and young patients. That's why we are the company which is not going by that way. No, we are finding the problem, creating solution with the method, creating threads, and then we do a lot of different research, and we have a lot of publications, clinical research as well as histological research, and only after that we are ready to share with you our experience, dear colleagues. There is another question. Thank you. Do you more webinar for body? A big hug from Portugal. I use it Aptos since 2006 for the first time. Thank you very much. I have been in Portugal first time in 1996 maybe, or 97, in the clinic of Dr. Rebello, Angelo Rebello, our good friend, and we shared between each other experience in that time. He showed us, yes, thank you, send him my regards as well. I have not seen him several years, and I will be happy to see him soon. So he shared with us his experience of liposuction in that time with the machine of Lipomatic, great machine which we are still using in our practice. And we shared with us, with him, our experience in that time of using a special method for tissue dissection, so-called Aptos wire we have in our range as well. So I'm happy to see these colleagues on my webinar as well, who are using threads since 2006 here. So yes, we are doing a webinar regarding body as well. I think you can find such webinar on our website, aptosvideo.global.com, or on our Facebook group, Aptos Experts. So, dear colleagues, there is no more questions. I hope that my presentation, my webinar was interesting for you. It will be helpful for your practice as well. And please join our webinars, the next webinars. Hope to meet you next weekend, 4 and 5 of July, on our Congress online, Colhida 2020. As I know, all of you who was today with us during this webinar, you will get possibility of discount, 25% of discount for this Congress. So if you will be interested to participate this conference, this Congress, please ask our team colleagues, and they will help you to get this discount for 25% for enter to this Congress. So hope to see you soon. Thank you very much, and goodbye.